Hello, Dr. Childs here. I'd like to congratulate you on completing your initial care plan. So you've got to a point where you're coming very close to the end of the initial phase of care. And I'm sure you're probably wondering at this point, where do you go from here? What are your options going forward? So today what I'd like to do is talk to you a little bit about what are your options going forward after you've completed either some initial spinal decompression care, maybe you've completed initial neurological based care for some type of problem such as vertigo or dizziness or a concussion issue. Maybe you've done our neuropathy program and you've completed phase 1 and you're wondering what's going to happen from here. So what we're going to do is when you come back, we just completed your final exam, maybe a re-x-ray, maybe some final eye movement testing, and you're going to come back, we're going to sit down, we'll go over your blood work, we'll go over your spinal x-ray corrections, we'll go over any of the eye movement changes you did through the care plan, and then we're going to sit down and we're going to give you some recommendations. So let's talk about that today. Let's go first into the different phases of care we have in our program. So when somebody comes into our office, typically, not always, but typically they're in some type of crisis. They're having some type of crisis care. They're having some type of condition that's unresolved, whether it's chronic pain, whether it's back pain, whether it's neuropathy, whether it's headaches. Maybe you had a concussion. Maybe you've got poor posture. So the first phase of care, phase 1, is when we see you for 3 months. We see you usually about 3 times a week for that 6 to 12 week mark. And in that time, we're going to work on condition correction, stabilization of a condition. We're going to work on corrective spinal care, correcting the structure in your spine, or some type of corrective neurological care. And then when we're through with that phase, you'll have a re-exam in the middle of the phase, which you've had, and then at the end of the phase, we usually take some new x-rays, we do some new blood work, and then we sit down and we have a re-report with you. Some people will go into what we call phase 2. Phase 2 is another 3 months where we see you twice a week. So some people need continued care. You may have a neuropathy condition where we improved your feeling in your feet by 50%, but you may be interested in continuing to get continued change or continued improvements in your neuropathy. You may be a concussion patient where you've come in for 3 months, we've dramatically improved your problem. You may have light sensitivity that went away, headaches are really dramatically reduced, but you feel like you're at 90%. So maybe we'll see you for a phase 2, which is twice a week. Some people will skip a phase 2 and go into phase 3, and that again, a phase 3 is actually 3 months. We'll do it for 3 months and then 1 time a week. So depending upon where you're at, maybe you're a corrective spinal case where you're not here for neurological care, you're not here for nutritional care, and we do a re-exam and re-x-ray on you, and we find that you've corrected your spine by 50%. That may be enough. You may be feeling good, you may be happy that you made a 50% correction, and you may not do a phase 2, you may not do a phase 3. So that's the initial corrective type of care. Then there's the other thing we call wellness care, and wellness care is what we call health care. So once we fix your condition, or once we get your spine as healthy as possible, maybe you have a herniated disc and we've got that as improved as possible, then we may put you on some type of wellness care plan for health maintenance. The ultimate goal is to maintain your health. And we may see you 1 time a month, maybe twice a month, maybe 4 times a month, depending upon how bad your problem is. If you have a lot of arthritis in your spine, we may need to see you a little bit more. Let's go back to this slide in just a little bit here. What I'd like to talk about are what are the benefits of regular wellness or maintenance chiropractic care, or what are the benefits if you're a spinal decompression patient, you've had a herniated disc or something like that, and let's say we get you to a point of being pain-free or 95% pain-free. What are the benefits of some ongoing wellness decompression therapy? What can we prevent here? So the number one thing to think of is an ounce of prevention equals a pound of cure. Medicine's always out there looking for the incredible cure for some type of problem, or the surgery that we can, they can cut the disc out or do something of that nature. But really, if you think about it, prevention is really the best way to take care of your health. And so we're going to talk about that a little bit today, and what are some of your options for health care, and not just condition correction and things of that nature. So the key thing is, how do you want to age? Let's say you've come into the office, your spine is misaligned, you've got some neurological symptoms, you have some back pain, you have some pain down the leg, and we correct your spine. So this is a nice, pretty normal looking x-ray, not misaligned at all. The discs are pretty much in pretty good shape here. Here's a patient here. He's probably in his mid to late 70s. You can see how poorly aligned his spine is. It's completely bent out of alignment. The black line is where he should be. All of his vertebrae should be lined up here. You can see severe degenerative changes. This guy is not really doing very well. This is the kind of guy that probably needs a walker. He probably has numb feet all the time. He's in constant pain, these types of things. So the question is, how do you want to age? Well, there's things you can do to really keep your spine like this through an entire lifetime so you never end up in this situation. So let's talk a little bit about the spine. Everybody in our office that has neurostructural care, we're going to work with their spine because we know that the spine is the connection from your brain to your body, and if your spine's degenerating, then so is your health. So these are some phases of degeneration. So we put you in either phase 1, 2, or 3, and this is normal. Normal is good alignment. Phase 1 is when you start to lose the normal alignment. So when you look at the spine is supposed to be straight from the front, and it's supposed to have 3 curves from the side, one in the neck, mid-back, and one in the lower back. So phase 1 is when you start to develop some misalignment in your spine. We call that subluxation or misalignment. Phase 2 is when you start to develop, the bones start to, because of the abnormal structure over a period of time, they start to wear out. And you start to develop degenerative joints. So the joints start developing bone spurs, the discs degenerate, and things of that nature. And phase 3 is when things really get really messy and when the discs are completely disintegrated and you've got bone spurs. And people like this have got really bad health. They're not really mobile. They're not enjoying their life very well. This is really a preventable situation. It's kind of like tooth decay in a sense. We use the same kind of charts as dentists do. So we've got normal, right? That's normal healthy gums, and they call it gingivitis, which is phase 1. Phase 2 is when you start to develop some tooth decay, and then you have advanced degenerative changes. So it's the same thing. Spinal decay is very much like tooth decay. And you can do some things to keep your spine healthy, just like you can brush your teeth and not develop this type of problem. You can keep your spine healthy through a lifetime, and you can really sidestep a lot of problems. So tooth decay is preventable with ongoing dental hygiene. So if you take care of your teeth, you brush your teeth, most likely you're going to keep your teeth. If you use floss and you do all this type of stuff. But some people don't take care of their teeth so well. They go to their dentist. The dentist says, well, we've got to do a filling, we've got to do a root canal. And then from there, hopefully, they'll decide that they need to do some ongoing maintenance or wellness. Spinal decay and degeneration is also preventable. So we can prevent this from happening with regular spinal checkups and spinal care. And so it's preventable with regular spinal wellness care. So that's some of the benefits. We can prevent arthritic aspects. Now, this is another phase of degeneration. The same thing, and this is looking at the structure in the spine. You should have a good curve in your neck. That's where it should be. Phase 1 is when you lose that curve in your neck. And when you lose that curve, it can create a lot of pressure on the joints. And what that does over time, phase 1 is when there's no arthritis yet. Phase 2 is when you start developing a lot of arthritis. You can see that the discs are starting to become thin. The black line's normal, the red line's abnormal, and this is phase 3. Phase 3, you have severe degenerative changes. Again, very much preventable with care. So, we just took a re-X-ray on you, and when you come back, we're going to go over and see how much of an improvement have we made. So this is a person that had forward head posture. This is the curve that they should have had. So this is a person, when they stand, their head is like way out here like this, right? And through the course of care, in that first phase of care, we did care, and we've improved the structure in the spine, and this was the post-X-ray on this guy. So now, if we maintain this, this guy needed, 3 times a week for 12 weeks, and then maybe a phase 2 for 12 weeks, and we got 100% correction of his forward head posture. But now, all he needs to do is some home exercises and maybe an adjustment 1 to 4 times a month to maintain that. And if that happens, he's not going to end up looking like a guy like this. This is somebody that's severely degenerative. They're completely hunched over. This is the type of people that you see, in a senior center where they just have not taken care of themselves so well. If we maintain somebody's spine through a lifetime, we can really prevent the arthritic changes in the spine. But this has huge benefits on a person's health. A person that's completely hunched over like this, they've got poor health typically, really poor health. So that's something to think about. Cervical degeneration again. So this is normal, and this is what can happen. You can see the discs become severely degenerated. Here's a lumbar correction. This is somebody that had a complete shift to their spine to the left, and this is a post-X-ray. This is the change. So this is corrective care. Now some of you have come in, and let's say you came in for like a head injury and you had a concussion or something of that nature. We may have done completely neurological based care. It may have been only eye movement exercises. It may have only been laser therapy and maybe some very gentle type of care to get your brain functioning better. And we may know that you have this loss of curve in your neck, right? This loss of curve in your neck, but at the end of your phase, because we didn't do a lot of spinal corrective care, we're going to see that you only have a little bit of correction in your spine. And so some people, after they get through their concussion care or their vertigo care, they may go on to spinal corrective care in phase 2. So that just depends, if that's something that you want. This is a lumbar surgery. You want to take care of your spine over the long haul. This is not something that you want. I mean, some people need lumbar surgeries, but this is a fusion of the two vertebrae together. And, typically this doesn't work for the long haul, and it's something you really want to prevent. And you can prevent it with wellness chiropractic care. So what are the benefits of wellness spinal decompression and wellness chiropractic care? What are the benefits? So let's say you just finished your phase 1 of spinal decompression care. Your spine is in much better shape. The disc in your back is better. You don't have as much pain. What do you want? What do you do from here? Remember, an ounce of prevention equals a pound of cure. So let me tell you a little bit about my story and why we have spinal decompression therapy in the office anyway. So back in 2003, we had our practice about 4 years. And at lunch, I used to go next door to the gym and play basketball all the time. Well, I was ready to play. I was going up for a layup, and this real big guy, 6'4" guy, landed right on me. Jumped up, and I was doing a little double pump action, trying to get him to bite and jump in the air. And then he came right down on my back, and I herniated and bulged a disc at L5. So I had this big herniated disc at L5. I went and had an MRI. On the MRI report, it said surgery necessary. And as a chiropractor, I really didn't want to do that. So I had a friend that had spinal decompression therapy. I went down to his office, did some spinal decompression therapy, but the drive started getting to me, so I decided to get some tables, at least one table for our own practice, and that's how we got into spinal decompression therapy. But I was told I needed surgery. But I did spinal decompression. I did it 3 times a week, probably did it for about 3 or 4 months, got to a point of being pain-free. But what I do now is I go on decompression about 2 to 3 times a month. Actually, about 4 times a month. I usually go on there once a week because I'm constantly bending over people. And this is back in 2003. Right now it's 2017. So, we're looking at 14 years ago. So I've been doing wellness care for my back for 14 years. The interesting thing is I was told I needed surgery. But the benefit was not just in me correcting and retracting that bulging disc with the decompression. The true benefits came from me maintaining it through a lifetime. Even if I only did it once a month, I probably would have avoided a surgery after I corrected the problem. But if I only corrected the problem with the 3 months or 4 months of care that I did, the initial intensive where I was doing it 3 times a week, and I never ever did the decompression ever again, I never did any spinal exercises again, what do you think would have happened? I think the problem would have come back, because it's always going to be a little bit of a weakness, but I'm really preventing the need for surgery. So that's my story. Let me tell you about the very sad Wegmans story. So I'm walking in Wegmans. I see a lot of patients at Wegmans, and you'll probably run into me from time to time. Wegmans is right across the street. I'm walking through, and this lady, that's not her. That's just a paid picture I put on there, obviously for HIPAA reasons. But this lady, super nice lady that I haven't seen in a long time, said to me, "Hi, Dr. Childs, how are you doing?" And she didn't really look so good. She was kind of all hunched over in pain. And she said, "You really helped me 2 years ago. Your program really helped. But I hurt my back again, and I had to have a surgery, and now they're telling me I may need to have a second one. Now this always makes me extremely sad. The reason why it makes me sad is because had she did our initial intensive phase 1, and then if she would have done just some wellness care, come in to see us 1 to 4 times a month at a much lesser rate than the initial intensive care, and she did that religiously, she probably would have never have needed the first surgery or the second surgery. That's the benefit. The benefits of wellness care far outweigh the benefits of the initial care. Okay? So it's something to think about. So people will always ask, no, why do I need to maintain my spine? Why do I need to keep going to chiropractic? You know, people always say, oh, you don't want to go to a chiropractor because once you go to the chiropractor, they're always going to tell you that you need to keep coming. That's like saying, oh, I never want to go to the dentist because once he tells me I need to brush my teeth, he's going to tell me I always need to brush my teeth. Or if you go to a nutritionist and they get you eating good, or you go to Dr. Durr and he gets your blood work in great shape, your cholesterol's down, your inflammatory markers are down. You can't decide, well, I'm just going to go ahead and go back and eat, Doritos and McDonald's and all that again. What's going to happen to you? It's going to become a problem. So anything that's truly preventable, anything that's truly wellness care, health care, you should have to do it in some form of maintenance fashion. So why do I need to maintain my health? Why can't my spine just stay healthy in the way it was when I'm 21? Why does a 30-year-old man stand like this, but if you look at that same 30-year-old man 40 years down the road, 40, 50 years down the road, he's hunched over and like this? What happened? Well, our body absorbs physical stresses, emotional stresses, and metabolic stresses that affect our spine. Here's some repetitive traumas: sitting positions, sporting events, lifting. These are things that we do daily. Sleeping with our head in the wrong position. You think that's good for the curve in your neck? Looking at a computer all day. What do you think that's going to do? On the phone with your head bent into a certain position. Lying on the couch. So these are repetitive things that we do, and over the years, traumas, car accidents, things like that, our body absorbs and takes the shape. Even just gravity over time is going to cause us to do this. So what chiropractic does is it nullifies all this. So you don't develop this kind of a mess. See, this kind of a mess was developed over 20 or 30 years. And so somebody like this, we can't fix and make like that. But somebody that gets fixed before they get to this point and then does some wellness care, some maintenance care, maybe 2 times a month, something like that, they're going to be in much better shape down the road. If you took a twin of yourself and you both did the spinal decompression program or the neurological program, and then one person continued with some wellness care and the other person didn't do any wellness care at all, what do you think would happen if we looked at these people 30 years from now? Which twin do you think is going to have a healthier spine? Okay? So an ounce of prevention equals a pound of cure. It's the difference between real health care and crisis care. If all you do is crisis care, you're never going to be healthy. So let's go back to the care phases. So you come in, you got a condition, you're in a crisis, we want to stabilize it, we want to get your spine healthy, we want to get your nerves healthy, we want to get your brain healthy. That's phase 1, for 3 months, 3 times a week. At that point, some people can go right on the wellness care because they made such great changes. Other people may say, well, I made about a 50% correction in my spine, I'm going to go to phase 2. And then at the end of phase 2, we take a re-x-ray and they say, well, I'm at 80%, I'm going to keep doing this because I'm feeling good, and we're going to go to phase 3, which is 3 months, 1 time a week. And then after that, if they get what's called the big idea, then they come 1 to 4 adjustments or 1 to 4 decompressions or something like that through a lifetime. Okay, just like you would brush your teeth through a lifetime. So that's the ultimate goal of chiropractic. And I've had patients that I've seen for the last 15, 16, 17 years, and I have patients that do phase 1 and they never come back and they're happy. Hopefully I won't see them at Wegmans, okay, with having a problem or surgery. So it's your choice. Your choice is to continue with more correction, which means to go to phase 2 or phase 3, more nerve regeneration, more stabilization, more health recovery, and more neuroplasticity in the brain. Okay, that would be phase 2 or phase 3. You only need it if we think you need it. You may not need phase 2 or phase 3. Some people are such good healers that they go right to wellness. Some people move right to spinal wellness and maintenance care at a frequency that works for them, 1 to 4 times per month, so that they can sidestep spinal degeneration. They could sidestep poor posture and all the effects that it has on your internal function. Or number 3, you can discontinue care. Some people after phase 1 decide they just want to discontinue care. They're happy, we fixed them, they're good, they high-five me, they tell me that they'll see me if the problem comes back again. Although we're kind of sad when that happens because we feel like the patient's going to run into trouble down the road, and if they just did the wellness care, they would be in better shape. But you're always welcome back. You can do as many phase 1s as you want to do. You can come back 5 years from now when you're back in pain. We'll take care of you any way you want it. But we just wanted you to have an understanding of what really is the philosophy of chiropractic. What is what we consider the big idea, that an ounce of prevention is worth a pound of cure. So I hope this makes a lot of sense. You're going to come back on your next visit. I'm going to sit down, or Dr. Durr's going to sit down, or Dr. Justin will sit down. We're going to go over exactly what we found. We're going to go over your x-ray correction. If you're a nutritional patient, we're going to go over your blood work. We're going to go over any changes that you made in your nervous system. And at that point, we're going to give you our best recommendation. We'll give you like a second best recommendation, and we'll give you some recommendation going forward for wellness care. If you decide to discontinue, that's completely fine. We just wanted you to be kind of educated before you came back. So we appreciate you taking the time to watch this video, and we'll see you in a couple days to go over your findings. Thank you.